Okay, so far we talked about hyperlipidemia. Yes? Okay. And hyperlipidemia leads to atherosclerosis. When your plaque gets really junky in there, that will lead to a symptom of angina, which is what we're about to talk about. Can they not call it something else? But okay then. Um, oh, okay. It does actually a little bit. All right. So angina means cardiac related chest pain. Okay, cardiac related. You can have chest pain for a million different reasons. Like what? Asthma, GERD, spicy foods. Like that's chest pain, right? But if we know it's coming from, that's called angina. Okay, and that is the probably the only sign and symptom that you're going to have of any of these heart issues. Okay. Now, why does it hurt? There's no oxygen, right? Yeah, and ischemia hurts. Your cells are like screaming as they're dying. I know, so sad. Okay.
Isn't it because like then it goes into like the anaerobic and then like it's making acid?
Yeah, so if you don't have any oxygen, then it's like, hey, we don't have any oxygen to break down. Now, what do you need oxygen for? How do you get it? Okay, so the oxygen goes into the cell and it burns glucose for ATP, which is usable energy. So if there's no oxygen, then it has to go to anaerobic metabolism, which means yeah, without oxygen, and that then the cells are going to end up dying anyway, and it hurts when your cells die. They go out with a bang and they scream and they hurt. Okay, so that is what angina is. You understand? There are two different types of angina. There's stable and unstable. Okay. Okay. So you need to know the characteristics of each because these are often on select all that applies for everybody in here. Okay. You're like, everybody's like, I know. Okay. All right. So stable angina. When you hear the word stable, what does that mean? It sounds nice, right? Like you can count on it. Yeah. I mean, of course, angina is not very nice. Huh? Well, no, but stable sounds like, oh, it's stable, right? This is like the dude you want in your life, or the girl, sorry. Okay, so when you have somebody in your life, like a partner, okay, you want the partner to be predictable, right? You know what they're going to do. Yes? Okay. Stable angina is predictable. You know when it's going to happen. Okay, so if someone had angina and I was like, hey, go run to that park, they're like, well, damn. They already know what's going to happen. Yes? Okay. It occurs on exertion because when you run, your body needs more oxygen. The oxygen demand is higher, right? So you can kind of expect it. It is relieved by nitro or rest. So like if they sit down, they're like, oh, probably won't hurt anymore. Or if I take nitro, what is nitro? It's a vasodilator, which will open up and give them enough blood flow. Yeah? It only lasts about 2 to 5 minutes, right? So that's nice. Yes, it comes and then it goes. Okay? And they know when to expect it and they know when it's going to happen, so they're prepared. That is stable. Sounds nice. Hmm?
What happens with caffeine?
What do you mean?
Like sometimes if you take too much caffeine, you have like chest pains.
No. It's tachycardia, right?
No. We should get you checked out though.
Not me.
Oh, if you're drinking so much caffeine when you're having angina, then you have drank way too much caffeine.
Well, I'm saying, but like, would it be stable?
I don't know. Yeah, it could increase your anxiety maybe. But this is usually where anxiety related chest pain comes from because you vasoconstrict so much that you don't get blood flow to the heart. Okay. All right. Unstable angina. This is like, I don't know what to expect. I don't know when it's going to happen. They could just be chilling, hanging out, and then it hurts. Okay. So it is unpredictable. It can occur when they're just sitting there and then they take a nitro and they rest and they sit and it persists, lasts more than 10 minutes. How do I know the difference between unstable angina versus an MI? But neither of them go away with rest. Unstable and an MI do not go away with rest. So how would you know? What'd you say? But so does an MI. So does an unstable angina. When? Sometimes. But how would I know? If a patient says, I've been having chest pain for 15 minutes, how do you know it's unstable versus an MI? I need to do a full cardiac workup on this patient. Yes? Okay. So I need an EKG and my cardiac enzymes. So anytime somebody has chest pain for more than 10 minutes or it is not relieved by nitro, they need to be in the hospital. They go straight to the ER and we do a full cardiac workup on them. Do you understand? Because it could be, they could be having an MI and they could just be like, oh no, I have angina. Sir. Okay? All right.
Unstable puts you at higher risk of an MI, but does it go alternative? Like if you have a history of a heart attack, are you at more increased risk of like having unstable angina?
Sure, because that means if you've already had something blocked before, but it depends too on what your interventions have been. If you got an intervention, then that would you probably wouldn't, right? If you got a balloon or a stent or a cabbage. But if nothing has changed for you, you just had an MI, then of course, yeah, you could have it again. Yeah. All right. So when a person starts having chest pain, what's the first thing they're supposed to do? How about sit down first? You want to? Okay. So we're going to have them sit down, and then they're going to take a nitro. What does nitro do to your blood pressure? That's not what I asked. What does it do to your blood pressure? Okay, so it decreases your blood pressure, which can make them feel dizzy and stuff. That's why you want them to sit down first. So if they're having chest pain, you want them to sit down. They're going to pop a nitro underneath their tongue, which is called a sublingual nitro, and then we wait. Okay, 5 minutes. If after 5 minutes it is not better, what should they do? Call 911. Yes, they're going to call 911 because how long does it take 911 to get to you? 8 to 10 minutes, okay? And I don't have that kind of time to already have maxed out on my nitro. Because how many times can you take nitro? 3, which is kind of stupid. It's like if it's more nitro or death, then, Excuse me?
On your paper it says 3 and there's something next to the 3?
Sublingual. Okay. All right, so when a patient started to have chest pain, what's the first thing to do? Sit down. Then what? Take a sublingual nitro and just chill, yes? Okay. After 5 minutes, if it is not relieved, you're going to call 911 and take another nitro, sublingual, yes? After 5 minutes, what do you do if it's still there? Take a third one, because the most you're supposed to take is 3, but you understand how that's kind of dumb, because they're not just going to sit, I know, but even if they're sitting there and 911 hasn't come yet, I'm not going to be like, well, I'm just going to simply pass away because I maxed out on my 3. No, you have to get a prescription. Yeah.
But like if it's
your very first time having chest pain, you won't have nitro.
No, you would just be dead. What?
In our simulation, we were giving nitro, and I said you're supposed to take your first one and then check your blood pressure. So, but if it's not working, you're not going to bottom out blood pressure, right?
Oh, no, you could totally bottom out their blood pressure, but what's your other option? Your heart muscle's dying, right?
You're not gonna take a fourth one, are you?
Well, okay, it's either take a 4th nitro or just be like, well, I's dead. So,
You take a birth nitro.
I mean, yeah, just not on the test. But do y'all understand what I'm saying? It's kind of like when we say, oh, you max out on epi during a code. Okay, well, they're already dead, so I can't really overdose them. Do y'all understand what I'm saying?
Yes.
Yeah. So, but they're only supposed to take 3 as long as 911 is coming. Oh, sure you could, but if you don't take it, you are already dead.
Death and death.
Death and death. Choose your way to go. Okay? All right. Do y'all understand what to do?
I have a question. For nitro, are you supposed to like, this could be a different head, but
Okay.
just keep it out of the sun?
Yeah, it's very chemically unstable.
Every 90 days?
Every 30, nope, sorry, 6 months it needs a refill. Yeah. All right, we got to keep going. Pay attention. Yo. Cool. Okay. So we're going to take this patient into the hospital, yes? Okay. What's the first thing you do for this? Well, no, I'm going to do a cardiac work with you in a minute. They do need a cardiac workup if they have unstable angina because I don't know if they're having a heart attack or not. Yes? Okay. So when they just very basic, I'm going to give y'all very basic care for what should be done. When a patient has really bad chest pain, they need to sit down first. Sorry, do home care first. They're going to sit down and then what? Take a nitro. You can also have them chew an aspirin. What would the aspirin do? It's an antiplatelet aggregator. What's the dose of aspirin we give them? 325. Then they need to take their nitro, call 911. EMS will come and pick them up, bring them into the ER. We're going to do a full cardiac workup on this patient to make sure they're not having a massive MI. What's our goal from getting them in the hospital until cardiac cath? How long do we have? 90 minutes, which is not a very long time for the entire cardiac workup that you need to do. Our goal is to get them in there so I can dig out all that stuff, right? That is called a PCI, which is a percutaneous coronary intervention, okay? And then if I can't do anything, if I can't intervene because they're too blocked, then I have to pull out and then we're going to say, hey, you need a cabbage. We'll schedule that for like tomorrow or the next day or what have you. Do you understand that? Okay. What does nitro do to your blood pressure? It decreases it. So they need to be sitting down and they should take their blood pressure. What's a criteria for any lower than this blood pressure and you should not give blood pressure meds? 90/60. Anything lower than that, you're going to cause them to go into shock because you're going to bottom out their blood pressure. Yes? Okay. So if their blood pressure is less than 90/60, should they be popping another nitro? No. Okay. If they say, oh my God, this nitro gave me a headache, what do you do? It's okay. Tell them it's okay. Okay, and then you can give them an aspirin if you want to because you were going to give them that anyway, right? But headache is the most common side effect of Nitro, because it is a vaso and it's going to bring a bunch of blood flow to your. Cool. All right. Do y'all understand the basics of angina?